Welcome to 340B Leaders Upfront, a monthly podcast from 340B Report. I'm Anna Mangum, host of this podcast, which showcases a fascinating, dynamic, and consequential area of the 340B drug pricing program, the industry-leading firms that support 340B providers in carrying out the program's mission, and the senior executives who help lead them. If you've listened to prior episodes, welcome back. We know you'll enjoy fresh new content and hot takes on current and emerging challenges in 340B and how major product and service providers are innovating to meet them. You'll also learn about the 340B career trajectories of the seasoned leaders of these firms and gain their valuable insights. If you're not already a subscriber to our news service, I encourage you to subscribe to 340B Report by going to 340breport.com and using the coupon code podcast25 to receive a 25% discount. If you haven't heard prior episodes, here's a little bit about me. I've dedicated my career to promoting healthcare access, quality, and equity. I've been a senior leader with a variety of major national advocacy and trade organizations, including 340B Health, where I worked closely with 340B Report publisher and CEO Ted Slavsky for over a decade. In this exciting new episode of 340B Leaders Upfront, I chat with Nick Rebmann, Executive Vice President and Chief Growth Officer of Pillr Health. Pillr Health is a leading provider of innovative solutions designed to optimize and streamline pharmacy operations. Their focus is on enhancing efficiency, reducing costs, and improving patient outcomes, particularly within the 340B program. Pillr Health is an Ultra Diamond sponsor of 340B Report, the highest level of sponsorship. We're very grateful for their investment in 340B Report. Today, we'll learn more about Nick, the valuable offerings Pillr provides, and Nick's perspective on a variety of hot topics in 340B. Welcome, and thank you for being with us today.
Thank you, Anna. I appreciate the opportunity to speak with you.
Great. Well, can you tell us a little bit about your life before 340B, including where you grew up and currently live, your educational background, and anything else you think would be helpful to the listener?
Yeah, thank you for that introduction about Pillr Health. Yeah, my career really began, I grew up outside of Buffalo, New York, in a small town, but people from Buffalo, anywhere you live in Buffalo, you say you're from Buffalo. So that's where I grew up. From there, I went to pharmacy school and took the 0 to 6 path at Albany College of Pharmacy and Health Sciences. I completed my PharmD there in the early 2000s and spent time in Albany in the summers. And once I graduated, I met my wife, who's also a pharmacist. We met here. She's from this area here in Albany. And from here, we really, started our career, started our life, and have remained in Albany over the last 20 years. From that point on, I started initially working at a national drug chain, Rite Aid Pharmacy. I worked for Rite Aid for about 15 years, starting out as a humble pharmacy technician, cashier, and working my way up through intern, staff pharmacist, pharmacy manager. I became a regional manager. I did that job for about 7 years. And at which point I decided that I was really interested in exploring other avenues of healthcare. And in doing so, I knew I needed to further my education. I ended up going back to school while I was a regional manager, and I did nights and weekends while I had 2 young kids, and my wife was working. It was a fun time, but it was a great opportunity for me to go and get my MBA and then, really take the experiences I had working coupled with the academic elements and areas that I hadn't had full exposure to, and really, added that to my list of credentials and kind of broke into the healthcare delivery space. I ended up joining one of the largest federally qualified health centers in the country in upstate New York, Hudson Headwaters Health Network. They had really a lot of growth happening, and they brought me in to help oversee the health center operations and total ops for the organization. I ended up finishing my time in that role as chief operating officer. So I was there for about 4 years. And in that time, they also had a wholly owned subsidiary called Hudson Headwaters 340B, which was my first introduction officially into the 340B space. There I served as CEO for 4 years. And subsequently, we ended up getting acquired by what is now today known as Pillr Health at the end of 2024. And I've since been working and helping this organization lead through transformation of organizations coming together between us, RX Strategies, and RPH Innovations, informing Pillr Health to what it is today.
Terrific. So you mentioned how you found your way to 340B. What do you enjoy most about this niche in healthcare?
340B is a really dynamic space. As you described it, I think it's a really niche industry. And when you're in a really niche industry, you tend to have a highly complex ecosystem. And there are so many different problems to solve. And those problems run from really understanding and having expertise in and around being very familiar with the regulatory landscape, making sure you have a firm grasp of technology. This is a heavily dependent technology industry. And so making sure you understand how the technology works to support the end goals of the customers and clients you support and the covered entities is extremely important. When you think about what makes this industry exciting is that it's fast paced, it's changing. Industries in general terms, for me, change is something I embrace. I really enjoy it. I like to be able to be in an environment that when the change is happening, there's several different ways you can solve and work your way around the change. And this industry absolutely provides that. So that's what I find most interesting about it.
So given that, you've described the ecosystem and what's unique about it, what types of skills or aptitudes do you think are useful for professionals who work in 340B, given the types of problem solving that the program increasingly requires?
I kind of think about it in two areas. I think about aptitude and I think about sort of competencies. I don't know if they're one and the same, but I think for people, you have to be naturally curious. You have to ask a lot of questions. I mean, you don't just drop into this industry with all the answers. I can firmly attest to that. You generally interact with your colleagues. You interact with folks that you first maybe taught you a little bit about the industry. You're going to learn from people who maybe report to you or people that work alongside you. So I think that general curiosity is really important. Needing to be strategic is also very important because as I talked about before, there might be multiple ways in which the problem presents itself, and making sure you're able to think through and contingency plan around what the next 2, 3, 4, 5 steps might be and what to anticipate there, I think is really important. Staying organized is also important when you're in a fast-paced environment, making sure that your organization is competent in what's happening around it, but also making sure that you have folks within your organization who are equally committed to helping solve some of those challenges that arise. And then lastly, I would say being innovative and creative is also extremely important. So those I kind of think of as competencies. Aptitude, I sort of think of experiences that might help people in this industry. So it's easy to say having a firm grasp of the entire pharmacy ecosystem, which is a daunting idea when you think about it, because there's so many different areas that 340B touches, but it does sort of lend its hand at the idea that understanding the intersection, which is where 340B is, between purchasing, procurement, payer, benefit, suppliers, technology, regulatory environments. I mean, it is right at the center of all that. And it's sort of interesting in different times when I've onboarded employees or new colleagues, we always talk about where this sits, and it touches all of those individual industries on their own right in this one industry of 340B.
Yeah, it is a highly intersectional program for sure. You mentioned onboarding folks. Let's talk about mentors, starting with who were the mentors that, or the mentor who has had the most impact on your own career, and how do you mentor others in this specialty? What's your advice to emerging leaders who will be taking on mentoring roles?
Yeah, I've been extremely fortunate at every stop. I've had great mentors coming up in pharmacy school, early professional career. I've had great mentors. I'd sort of consider mid-level management mentors who were able to sort of teach me the value of how to execute strategies and how to get results, how to take care of customers in the early days working at an independent pharmacy. So all of those experiences to me were individual mentor, where I was the mentee and I was being mentored by those folks. And then later, moving into more executive type roles, I continue to still have and had great mentors. There's people I talk to every couple of weeks who have helped change the trajectory of my career. And I just am such a firm believer in mentorship that one of the things that sort of resonated with me is that I was always willing to say yes when people ask me for support, whether it was, hey, Nick, we want you to go do this job, or we want you to try this particular area of new growth, or whatever the case was. I always said yes. And then in return, I would always ask people for help, like those mentors. I would say, hey, can you help walk me through this? And I think when I've talked to people that I have mentored, I always tell them, I say, always say yes, take the chance. And, if you don't, you might regret it someday. And there's a really interesting video on Steve Jobs, and he's kind of talking about his experience in asking people. And I think it's such an important message that most people are afraid at the risk of rejection to ask for mentorship or ask for support. So that's one of the things for me personally that I have always done, is always asked. And then anytime people ask, it's almost always met with a yes.
Let's pivot and talk a little bit more about Pillr. What are your key products and services to 340B stakeholders and the broader healthcare supply chain, and what makes them distinctive?
So Pillr Health, as you pointed out in the introduction, is a very broad and dynamic organization that really focuses in pharmacy optimization operations and cost containment, pharmacy cost containment specifically. So I kind of think about it in a few different categories. Pillr Health can be a provider of all the things that pharmacy touches, whether it be the traditional 340B contract pharmacy, split billing, mixed use hospital provider, entity-owned pharmacy, technology provider. We have sort of that as coverage. That's what I would consider our core competencies as an organization. What's sort of happened over the last several years is that covered entities have come to us and said, oh, do you do audits, or do you provide advisory services or consulting? Or, hey, we really see the value of operating and building out our own retail pharmacies, or we want to have a more thorough understanding about how to become a specialty pharmacy and what comes along with the accreditation responsibilities associated with that. So when you think about today where Pillr Health is, we can kind of accommodate any of the organizational needs that a covered entity has. And the breadth and depth of our experience in each of those, I think, is best in class compared to any organization in the marketplace today.
To that point, what are some areas where your clients are particularly needing help these days and where you can offer that best-in-class support?
Our clients, the needs today, generally, the technology is always important. I mean, that's mission critical. So how do we continue to offer a high end user experience that makes their jobs easier? There's so many things that the covered entities are doing day in and day out, and their job is to take care of patients. Our job is to help them be able to do that in the most efficient manner. So whether that be at the pharmacy level, whether that be at making sure their technology achieves the desired outcomes and results that they expect without having to ask for tickets or have something go sideways. We have to make sure that we have a very sound and steady platform for our clients to interact with and engage with in order to manage their 340B program. In the context of the other products and services that we have, making sure that we're able to interact with reporting requirements that have become standard now in the industry. So making sure that process is easy. We've been really getting lots of questions and outreach for support regarding pharmacy expansion in building a pharmacy or helping them build a specialty pharmacy. That's an area that we've put a lot of time and energy in over the last 12 months and built out a team to be able to deliver that for organizations that need that service. So that's been one that we're really focused on right now, is our Pharmacy Accelerator division.
Well, that's exciting. In addition to the other work that you're doing, I see that you're president of the board of Community Voices for 340B. Can you tell us more about this initiative and why you've become involved in this cause?
CB340B, as it's often referred to, is a really great organization, and it's a grassroots organization that's designed to help covered entities find pathways to really tell their message. And one of the things that we see as an area of opportunity in this industry is covered entities oftentimes don't have the resource. They may not always have a regulatory division or a public relations division, or being able to get out there and explain the mission that they are providing and what they're doing for their communities. And so it doesn't always come natural. They're focused on patient care day in and day out and all avenues that's associated with patient care. So when they do have the desire to say, hey, we want to be able to explain there's maybe some negative ads or negative campaigns in their communities about this industry or healthcare in general, they can reach out and work with CB340B to build a positive message about what it is that they're doing to really impact the people in all of their communities while there may be negativity in other areas. So Pillr Health is a founding member of CB340B, and having been able to get involved and help sort of reposition and direct where that organization sort of is heading over the next 5 years, I think it's an important mission. I'm really proud to be a part of that team. And we've got a really great board contingent that's also aligned around making sure that we're able to do our best effort to help support covered entities across the country.
Well, that's terrific. As you know, the Health Resources and Services Administration, HRSA, has resubmitted its proposal for a rebate program for 340B. Pursuant to the halt placed by a federal judge on the program pilot, HRSA has issued a request for information to stakeholders, inviting input on whether the agency should implement a rebate model under the 340B program and how best to operationalize any such framework for stakeholders. Comments are due very soon on April 20th. 340B providers are working with lawmakers on Capitol Hill to try to block the rebate from going forward. But I know there's a concern from the covered entity community that it could move forward. How have you been supporting clients in preparing for the launch and now in navigating the uncertainty regarding when this pilot might be implemented?
Yes, April 20th is right around the corner. And we, as Pillr Health, were prepared for what we originally thought was going to be the pilot that went live in January. So we put in a lot of time, energy, and effort into making sure that we had the appropriate capabilities to be able to interact with the parties who would be processing those rebates in an effort to make sure that the covered entities were receiving the savings, yes, in another way than what they've traditionally done versus the purchasing side of 340B and receiving that rebate. We are prepared as an organization to be able to support all of our clients in the world that might come forward with rebates being the standard. We think that our position organizationally on the rebate program is that it is bad for covered entities. We feel that what's been working is working very, very well for covered entities. This adds, again, another element that creates uncertainty, that puts the decision-making outside of the organizations closest to patient care. We think it's a bad move overall. But as we know, things change. Nothing stays the same forever. And it's our job as a provider of 340B technology and services to make sure that we're able to support our clients should any of these changes come to fruition, which, to your point, we anticipate that this is a high probability will likely happen.
The Medicare drug price negotiation program, which went live on January 1st, is underway. How are you supporting clients in simultaneously navigating multiple pricing and reporting regimes?
When January 1st hit, it was a lot of moving parts between the IRA and the proposed rebate. And why that happened that way is still beyond me, because it created a lot of confusion in the covered entity community. It created confusion because you had this IRA effect going live that was written into law, I think, a couple of years ago. And then you had this last ditch effort to use the same products for the rebate model pilot. And it created all sorts of confusion for the covered entities, which I think was not helpful. And so when you break it apart now, it's like just the IRA is in place today, which is ultimately the result of CMS negotiating prices with the pharmaceutical manufacturers directly. We've been able to take the data for our covered entity clients and really help them understand what the effects are going to be going forward, because there's a multi-phased process for the ramp up of this over the next several years. And really right now, if they own a pharmacy, we help them navigate ways in which they can still create value for their patients in that instance. We've seen some challenges on the contract pharmacy side with some contract pharmacies choosing to not include those products as 340B eligible. So there's been a number of different problems to solve with the IRA going into effect in January, but we're now 3 months in. We've sort of begun to see what the effects of the IRA look like, and we are closely monitoring it to support our clients any way we can to help them get the best available information and how the pricing adjustments are affecting them.
Drug manufacturers have different contract pharmacy restriction policies and different requirements in working with their vendors, 340B, ESP, and Calderos. Third-party administrators play a key role in submitting data and helping their clients through these challenges. Can you tell us more about how your firm is supporting covered entities in this area?
Pillr Health has all of the capabilities and we've had this ability for a number of years since the first manufacturer restrictions went into place, which is hard to believe. It's been almost 4 or 5 years at this stage. So we've been able to fine tune that process and make sure that the data that flows from the covered entities to us, to the reporting organizations, is seamless and creates the intended outcome in making sure that they have pricing restorations in place for those contract pharmacies that exist. The more recent events where we're starting to see data requirements for entity-owned pharmacies is probably the newest frontier that's being explored by the pharmaceutical manufacturers. And we also have the ability to make sure that we're able to do that on the covered entity's behalf. It kind of reminds me of several years ago when the restrictions went into place. There were some covered entities that chose to not report data in an effort to create some movement that maybe there was going to be a restoration down the road. But as people realized, this was kind of here to stay. And as a result, gave up significant savings during that time period. And I think as you start to see more data requirements come in for entity-owned pharmacies, those covered entities are going to be faced with the same decision-making tree of, to do it, to not do it. And they'll all have their reasons for, whatever their intended outcome is and whatever their answer is that they arrive at.
There continues to be a lot of action at the state level in 340B, and this includes additional states passing contract pharmacy protections and provider reporting requirements. How are you helping clients navigate these opportunities as well as the challenges?
Yeah, the last couple of years, we've seen really great movement at the state level. There's over 20 states that have passed contract pharmacy protections, a few that have lingered and are still getting held up in appeals courts. But that's been a really positive change for covered entities within those states. We are immediately able to help recover the savings that they had to initially give up. And what we're also able to do is help clients that we have in other states, help them come up with strategies to pursue the similar interests that where states were successful in passing those contract pharmacy protections. We'd love to see that continue in states where they aren't in play. And what we're seeing today is organizations like CB340B and other advocacy groups really helping ignite the torches in those states and find ways that they can create different covered entity coalitions to help solve and get legislation written and get it onto their respective legislative branch floors to start exploring the possibilities of what 340B does, how it impacts communities, and how it continues to be a program that does not require taxpayer intervention to support it. And it's a great story to be able to tell. And our hope is that we continue to see more states adopt that theory that's already in place in the states where they have protected contract pharmacies.
Those are really important initiatives. Do you have any final thoughts or words of advice, Nick, for the 340B community?
I think the 340B community has been resilient to date. There's been a variety of proposals, changes, different advancements over the years that have caused consternation and have caused concern within the community. But each time this community has been able to overcome those challenges and those obstacles. And those that are most able to solve problems and figure out a way around the obstacles will be successful. And I think this industry has shown that that can continue to be the case. It's going to be a little bit different, I think, as we go forward, because so much of it is placed around outside of the covered entity's control. And I think self-education and making sure that the covered entities are partnering with organizations like Pillr Health or others to really have a firm grasp of the regulatory environment. When they do that, they can then begin to think through what is it that they'll have to do in order to solve these obstacles and overcome them and continue to do what they do best, which is provide patient care to patients in need. So that would be my advice to the community going forward.
Great advice. Yeah, resilience is so very important, and keeping your eye on the prize. So thank you so much, Nick, again for joining us today. And to our audience, stay tuned for our next podcast, which will occur next month. If you're not already a subscriber, please consider subscribing to 340B Report by going to 340breport.com and using the coupon code podcast25 to receive a 25% discount. It's the best way to stay on top of the latest developments in the ever-changing 340B program. Also, check out our other podcast, Inside 340B Report, to hear our journalists discuss the latest 340B developments.